Okay, we're gonna do my testosterone shot. First of all, I have to look up how to do it. How to give testosterone shot. Medication in a vial. Disposable syringe and needles. One 18-gram needle to draw the medication and one injection needle. Okay. Take the cap off the vial. Put the 18-gram needle cover straight off the syringe. Then Then pull back the plunger and draw air into the syringe. The amount of air drawn into the syringe should be the same amount as the dose that your doctor prescribed. Okay, it is inject 0.5 milliliters. So the 5 is like right here. So we're going to draw air out to 0.5. Insert the needle straight down through the center of the rubber stopper. Do not put the needle through the rubber stopper more than once. Push the plunger of the syringe down and push the air from the syringe into the vial. Okay. Keeping the needle in the vial, turn the vial upside down. Position the needle so the liquid is covering the tip of the needle. Keeping the vial upside down, slowly pull back on the plunger to fill the syringe with the medication to the number that matches the dose your doctor ordered. Okay. Keeping the needle in the vial, check for air bubbles in the syringe. If there are air bubbles, gently tap the syringe with your fingers until the air bubbles rise to the top of the syringe. Then slowly push the plunger up to force the air bubbles out of the syringe without removing the needle from the bottle. Okay. Yes, there is air. I'm not sure where exactly, because there's still air in there. After air bubbles are gone, pull the plunger back to the number marking on the syringe that matches your dose. Okay, let's just push all the air. There we go, and then draw it back. There's still bubbles, but I think that's okay. I always inject a little bit of air accidentally anyway. Okay. Remove the 18-gram needle and replace it with the injection needle. For one of my doses of this, I reused the same bottle like 3 times because it had enough in it for like 3 or 4 doses, and I was too lazy to go get a new prescription, and I never got any infection, but that's what you'd be worried about. Um, okay. Now the scary part. You're supposed to use an alcohol swab, but that seems like an optional step, and I don't have one anyway. Okay, I'm doing it subcutaneous, not intramuscular. Like a shot is intramuscular, but subcutaneous is just into like a fatty area, so it hurts a lot less. Sometimes it barely hurts, and sometimes it hurts a lot. One time I did the shot, and then I found myself on the floor, and I was not sure how I got onto the floor. I'm really scared of needles. Okay, let's do it. Okay. I do not enjoy doing this at all. And I'm also always worried about leakage, because sometimes it leaks out of the hole. You just have to do it really quick. There we go. It didn't really hurt. Sometimes it does, sometimes it doesn't. So far, no leaking. Okay. I'm gonna wait a little because I think that might make it less likely to leak. There we go. Ooh, that's a lot of blood. Weird. And we always keep the used testosterone vials and the used needles with the most recently used needle in a special bag in case I don't get my next prescription for some reason. I can reuse the vial because there's always dose left in the vial, and the danger with that would be infection. But like I said, it's kind of unlikely, so I would consider doing that rather than skipping a dose. The G stands for gauge, not grams, sorry.